So hello, everyone. I am Mariah Casillas, the VP of Learning and Evaluation at Philanthropy Network Greater Philadelphia. And we are very excited to have you here and all of our great speakers brought together by the Gender Justice Fund to discuss really what, is the role and obligation of philanthropy should Roe v. Wade be overturned in the coming weeks. And I think as your, this great group and all your attendants attest to, this is a timely issue funders need to be prepared to respond to. But I think as you'll also learn, and you probably already know, this decision could compound inequities in care and resources that are already at a really unacceptable point. So with that, I'll turn it over to the panelists to introduce themselves and why they are here today, starting with Farrah Parks, Executive Director of the Gender Justice Fund.
Morning all, thank you so much for being here, and thank you Philanthropy Network for helping pull this together. My name's Farrah Parks. As Mariah said, I am the Executive Director of Gender Justice Fund, and with me are a couple of our grantees and also a representative from Planned Parenthood of Pennsylvania advocates, and I'm just going to let them each introduce themselves really quickly. So maybe starting with Carol, then Alicia, then Signe. Carol, you're muted.
That's okay. Thank you. I'm Carol Tracy, and I'm the Executive Director of the Women's Law Project. We're a Pennsylvania-based public interest legal organization. We actually were counsel in Planned Parenthood versus Casey and have been involved in just about every major abortion case before the United States Supreme Court. And we currently are before the Pennsylvania Supreme Court. I'll talk about that a little later.
Thanks, Carol. Alicia?
Good morning, everyone. I'm Alicia Gonzalez. I'm the Executive Director of Abortion Liberation Fund of PA. We changed our name last fall from Women's Medical Fund, and we are the state's largest and oldest abortion fund in the state, spanning almost the whole state, but just a little bit shy of covering the full state. We provide funding for abortions because the state doesn't allow people to use their insurance to cover the cost of the abortion. And we also are working to build community power and foster community support. So I will talk all about that in a second, but thank you for having me.
Thanks, Alicia.
Hey everyone, my name is Signe Espinosa. I use she, her, and AO pronouns, and I'm the Executive Director at Planned Parenthood Pennsylvania Advocates. We are the policy and advocacy arm in the state, not to be confused with our C3 affiliates who are health centers who offer healthcare across the state. As I mentioned, we're the policy and advocacy arm, so you will see us defeating anti-abortion bills in the state legislature and organizing to ensure that we elect candidates up and down the ballot who have the best interests of Pennsylvanians and put healthcare first.
Thank you all. And as Mariah mentioned, we'll be sort of just going through, I'll go over the agenda in a second. But if you have questions and comments, feel free to put them in the chat, and questions we'll be keeping track of and get to them towards the end. So just to quickly go over what we're going to be talking about with just introductions, I'm going to talk a little bit about what we know about the impact of abortion restrictions. And then the folks on the panel will talk a lot about the Pennsylvania context, and I'll come back in to talk about what funders can do, and then we can do questions and discussion. So what do we know about the impact of abortion restrictions? Well, we know for a fact that they will definitely impact those already the most marginalized. We don't necessarily even need data for that. Some of you may be familiar with the Hyde Amendment, which prohibits the use of federal Medicaid funds for abortion. And literally when Henry Hyde was introducing that in Congress, he said, we can't stop rich women from having abortions, but we can stop poor women. He literally said that. And this country has a really kind of honestly ugly history of reproductive control, starting very much with slavery, and initially female slaves were not actually that highly valued. Then the slave trade was ended, and so they couldn't get new slaves, so then female slaves became much more valued. And there's a long history of racialized reproductive control, be it forced sterilizations or restricting poor people's abortion access. And so that is just sort of built into the fabric of this whole scenario. And I just wanted to name that before we get into some of the more sort of tangible things. So we also know that abortion restrictions create ripple effects, including poverty, domestic violence, adverse child outcomes, and health implications. So some folks at USC were fortunate enough to get access to data that they use for what's called the Turnaway study. And you can look this up. I believe Philanthropy Network will be sending out links of resources at the end, and this will be in there. There's a book that you have to buy, but there are, you don't have to buy it, but if you want the whole book, it's only available for sale, but there are briefings and many free articles about it. But basically they got access to a bunch of people who had been seeking abortions, but for one reason or another were unable to get them, mostly due to the timing. And so then they followed them over several years, and they also followed a control group who had gotten abortions. And what they found was those who wanted abortions and had not gotten them were much more likely to be poor. They had lower credit scores. They were more likely to be in debt, evicted, bankruptcy, which is not surprising. One of the reasons that many folks seek abortions is that they cannot afford another child. Another thing that they found was that folks were more likely, if they were in a domestic violence situation, to be in contact with the violent partner, again, because if that partner is the child's parent, then they probably have some parental rights, or also, because they have a child for financial reasons, they might need to stay in touch to get child support and things like that. They also looked at outcomes for the children that were born to folks who had been seeking abortions. Unsurprisingly, they were also likely to be poor. Their parents were poor, but they also had poor impacts in terms of maternal bonding and therefore child development, because the parent-child relationship is really important. And for folks who had been struggling and had wanted to terminate a pregnancy, it can be understandably difficult to really do the work that needs to be done to be a strong parent. We know parenting is one of the hardest jobs in the world. And finally, and very importantly for Pennsylvania, which I'll talk about in a second, there were lots of adverse health consequences. So much higher incidence of pregnancy-related complications like eclampsia, hemorrhage, gestational hypertension. And despite what you hear from the right, abortion is actually much safer than giving birth, especially in a state like Pennsylvania. So that's just an overview. There's many more impact, obviously on high school dropout rates and things like that, but just wanted to give you a context for how this is not just about, one person and their decision to have a child or not have a child, but it has repercussions both for them and their families long term. So about the Pennsylvania context, which I alluded to, one of the awful distinctions Pennsylvania has is that it's a very unsafe place to give birth. Maternal mortality is a real problem in this state, and pregnancy-associated deaths in Pennsylvania rose 21% between 2013 and 2018. So not only is it already bad, we're increasing the rate at which folks die perinatally. And this has a racialized component because non-Hispanic Black folks accounted for over 23% of the deaths over this time period, even though they were only 14% of the births. So it's particularly important to think about the Pennsylvania context where giving birth is already a risk, particularly for Black and Brown folks, and the idea that folks might be forced to carry more pregnancies to term, given that it's such a dangerous thing. One of the other things that's very peculiar about Pennsylvania is that we have a very large number of crisis pregnancy centers, which claim to promote maternal health, but don't. I'm going to ask Sydney to talk a little bit about those.
Yes, absolutely. And I promised Farah that I wouldn't go off on a tangent that's too long here, because I do feel like talking about crisis pregnancy centers and their role in the state, and just how over the course of decades and decades in Pennsylvania, they've been heavily funded by the millions, is just a long history and a really big separate beast. But like Farah said, they are anti-abortion organizations that really that target low-income folks, Black, Indigenous, people of color, who are facing unintended pregnancies to prevent them from essentially having an abortion. But they are also, you know, like Farah said, they're not health centers, they're not providers, they're not doctors, so they are not bound by HIPAA. And the other piece that is really interesting in the maternal mortality conversation is that they also don't provide prenatal care, right? So they are also delaying healthcare for folks who are maybe making the decision to keep the pregnancy. And so they play a really interesting role in the state of Pennsylvania because they are heavily funded by the millions. They outnumber real health centers and clinics in the state, but from, I believe it's 9 to 1 in the state. So they really are everywhere and strategically placed outside of real healthcare centers, outside of Planned Parenthoods. You'll see them outside of indie clinics. You've probably seen them before. They have like free ultrasound all over their vans, or, you know, are advertising pregnancy tests, and are really cruel in their tactics in really targeting poor folks and folks of color by offering other kinds of services like diapers and pregnancy tests. And I think one of the things that is always really important to lift up, that is probably the most egregious things that I want to lift up, is that they, in addition to getting a lot of state funding, they also get funding from TANF, which is the Temporary Assistance for Needy Families funding. So we are quite literally taking away money from a pot of money that is really needed to support families to essentially fund violence, right? Like these are violent centers. Delaying care and operating under deceitful tactics is violent for communities of color and poor folks who are trying to access care. So, you know, like I told Farah, it's a long history, and we are really thinking about at Planned Parenthood and with our partners, the role that they will be playing when Roe falls is going to be really interesting as our clinics continue to experience, you know, wait times, and we will be seeing a lot of folks from other states and surrounding states coming to Pennsylvania. So they also, you know, work with opposition groups, and in addition to being heavily funded, are supported by anti-abortion legislators in the state. So yeah, that's kind of a little bit of a gist about them, but really important in this context as we're thinking about what the key players are in the state as we are fighting to ensure that folks have access to safe legal abortion, and really are gearing up for what their role is going to look like, and also like an uptick in violence outside of health centers as well, as folks are continue to be emboldened with what's happening across the country.
Thanks, Sydney. And you mentioned, you know, what happens after Roe. And for more on that, I'm going to turn to Carol Tracy from Women's Law Project to tell us, what do you think we can expect after the Dobbs ruling?
Well, one is never certain what a court is going to do. There's always those caveats that we say. But if Roe is overturned, as is widely expected. First of all, 26 states immediately or within a month will criminalize abortion. That's a staggering number. Pennsylvania, it's important to know, is not one of those states. So there is the expectation, of course, then that we will see an incredible influx of patients from other states. We are already seeing in Western Pennsylvania quite a few clients coming from Ohio and West Virginia, and there is the expectation that it will come from Tennessee and Kentucky as well. And I mean, people literally are talking about the thousands. And there is limited capacity. We have 19 providers in Pennsylvania. And by the way, just going back to a little bit of what Signe said, there are about 150 CPCs in Pennsylvania. So just keep that in mind. So the weight on abortion providers in Pennsylvania will be enormous. And Pittsburgh, the Pittsburgh, Western Pennsylvania area is considered one of the 5 regions in the country that is expected to see the heaviest patient surge. And it is also going to bring up a lot of issues if someone gets a service, particularly medication in Pennsylvania, and goes back home to another state. What are the legal criminal ramifications of that? Will a person in Ohio, for example, be charged with murder? And these are unanswered questions. And so one can expect after Dobbs, assuming that they do overrule Roe, that there is going to be a considerable amount of chaos and an incredible need for medical services and not enough services available. It will be a real crisis.
Right. And you mentioned before that Pennsylvania is sort of is not one of the states where there is already a bill in place, a law in place to automatically make abortion illegal. But Women's Law Project is also currently working on a case that could impact this. So I'm going to invite you to talk a little bit about that.
Well, and again, I'm always cautious about talking about a case that's in progress, but Allegheny Reproductive Rights versus the Department of Human Services is a case that is currently awaiting argument before the Pennsylvania Supreme Court. And this is a case related to Medicaid funding, but is brought with the legal theory that abortion is a fundamental right under the Pennsylvania Constitution, under our Equal Rights Amendment and under our Equal Protection Clause. And prohibiting Medicaid funding is a violation of the Constitution. So that we anticipate it will be heard in the fall. We have a progressive Supreme Court. And because we have such a progressive Supreme Court, there is a huge effort now on the part of the antis to introduce a constitutional amendment that, should we win our case in Pennsylvania, the constitutional amendment will be needed to ban abortion. And Signe is going to talk more about that. She's on the ground doing work in that area. So, you know, there's on one hand, you know, positive news that we think that our case is very strong in Pennsylvania and our Supreme Court is very progressive, and they've been, you know, quite impressive on a number of other cases. One can never predict whatever any court is going to do. I have to say that both about SCOTUS and Pennsylvania. But we are far more confident, I think, in our arguments and our chances in Pennsylvania than we are before anyone before the United States Supreme Court.
Thanks, Carol. And Signe, do you want to talk a little bit about what you all are working on with regards to the constitutional amendment?
Yeah, absolutely. And Carol's definitely spot on. We heard from opposition in Harrisburg that the efforts to amend our state constitution to clarify that there's no right to abortion or abortion funding was because we know that there is a case to be made here for that. So kudos to all the work from the Women's Law Project. So we do have a constitutional amendment that is moving. It was voted out of committee already. That is Senate Bill 956. There is a companion bill on the House side, but we're seeing more movement on the Senate side. And it sounds like folks on the Senate have a little bit more of a craving to get this done. So this is essentially a bill that would propose to amend our state constitution and take away any state protections for abortion access or funding in the state. But because this is a constitutional amendment, it's really important for us to make the distinction that this isn't just any kind of bill. This is a really extreme proposal, right? That has a little bit of a different process in the state that many of us, even that work in this space, are still learning and grappling with as well, right? So I can't even imagine, had I not been working at Planned Parenthood, I wouldn't really know anything about constitutional amendments, right? So that's why we're doing a lot of work to ensure that we're educating supporters and the general public about what this proposal means. So this proposal would need to pass 2 consecutive sessions before it can reach voters in a statewide referendum. So if we see this bill move this month and it passes both chambers, we would need to see it pass next legislative session again, and we would potentially see this on the ballot in early 2023. So then it would be left up to the voters, which is really frustrating in ways for us because, this is taxpayer dollars and support going to a proposal that we know that the vast majority of Pennsylvanians support access to abortion, right? And, this is just opposition trying to get its way, trying to legislate in ways that is really anti-democratic and anti-popular opinion. But what is really important to lift up about this constitutional amendment, and I think in the landscape when we're talking about the Supreme Court and the federal landscape in general, is that this is the beginning of a really long fight, right? This is about abortion, and it's also about the full range of sexual and reproductive health care. In the constitutional amendment, there's language that would make it the state policy to protect life from conception until birth. Right. So when we read that language, conception until birth, we know that could have implications for our contraceptives, our IVF care, miscarriage care, and just basic decisions about how, when folks want to give birth or not. So it's really concerning for us. But in ways we're happy that the language is really clear. So we are messaging and organizing in communities to make sure folks know that Pennsylvania is in a really interesting place when it comes to this conversation, right? We have both chambers controlled by anti-abortion legislators, but we have a friendly, governor's administration. We are right now in the middle of an election season, right? So we have the opportunity to elect a reproductive healthcare champion in the legislature, which will be really important. But I do want to stress that what is really another piece that we want to lift up for folks is that constitutional amendments, these bills cannot be vetoed by the governor, right? So that's another loophole for opposition. And something that I think they've filed maybe 90 constitutional amendments this legislative session alone, really undermining the power of the governor and, like I said, the general public. And so it'll be really important to have a friendly governor, because even though he's not able to veto this legislation, he would be able to, a lot of the language goes through the administration for what the ballot question will look like, right? So, that there are really important reasons why our electoral work is so important. And if this, for whatever reason, they don't move forward with this, we will continue to have that veto pen as a last line of defense, which is going to be really important in Pennsylvania. But yeah, the bill, big question mark as to what the timeline is. We haven't heard anything concrete We know that folks will be in session next week, so we could see it move next week. We're really operating in any day now. But I think it is safe to say that this is the most extreme proposal we've seen in Pennsylvania. We've continued to see, and we don't really tier or rank, anti-abortion bills. They're all horrible, right? Like whether you're talking about a Down syndrome abortion ban or a reason ban, a 6-week, a 20-week, whatever it is, they're all horrible. But this one would really open up the door for all of the bills that we've seen in years and years and years, fetal homicide, personhood bills, you name it. This would open up the door for that docket of bills to pass, right? And then some, right? So I think really important that we're talking about just the state of play in Pennsylvania and, the impact that the constitutional amendment could have in these conversations.
Thank you for that, Tini. And I think just preparing for this conversation, I've learned so much from all of you, and just about, it's very complicated, which I feel like is part of the goal to make it harder to oppose. But so that's some of the sort of judicial and legislative context. But to talk about access to services, I'm going to turn it over to Alicia. Carol talked about how Pennsylvania is expected to see an influx, and as the largest, abortion fund here, a lot of those folks seeking abortions go through you for support. Can you tell us what's been going on with that?
Yeah, absolutely. No, thank you so much. I think you really hit the nail on the head by starting off talking about the Hyde Amendment. And so that Hyde Amendment that went into effect in the 70s and then in Pennsylvania, in the 80s, made it so that we have been living in a post-Roe world since that time, right? So Black, Brown, Indigenous folks who are experiencing poverty have not been able to access abortion care since the 80s in Pennsylvania. And so some of the restrictions that we're seeing come down the pike are only making it more complicated to an already burdensome process of trying to get abortion care, right? And so there's a 24-hour wait, there's state mandated counseling that does nothing to actually provide accurate medical care. There's judicial bypass, which means that if you're a young person under the age of 18, you have to get your parents' consent. And if you can't get that consent for all the reasons why people can't talk to their parents about these things, you have to go before a judge to show that you're emotionally mature enough to have an abortion, right? Not to have a child, but to have an abortion. As well as just a slew of other restrictions that are on abortion providers, making it really impossible for people to stay open, quite frankly, which is why 86% of counties don't have a provider. So it's not just about looking forward about what's going to happen in June in the SCOTUS case, but also looking at what's already on the books. And I think the silver lining, if you will, on this cloud is that people are differently alert now to just how bad it is to access abortion care in our country, but also specifically Pennsylvania. So that at least is a little bit of saving grace because folks are rightfully so angry now. And those of us who have been doing this work for a while, we're like, welcome. Where have you been? Welcome. But yeah, so we know that the Hyde Amendment is racist and that it by design was going to hit folks who were already struggling to get by and already on the receiving end of systemic oppression. And so we serve about 3,200 people a year with funding. On average, our pledge that we give out to folks is just about $181. At the height of the pandemic, again, because there's layers upon layers upon layers of oppression and harm, specifically again to Black and brown bodies. But because of the pandemic and the economic implications of that ongoing pandemic, we saw our average climb as high as $250 per person, which is a huge leap from before COVID, which when it was about $130. So anyway, so we're giving out about $180 per person to around 3,200 people in our area. We last year gave out just under $667,000 in funding. This year we're slated to give out just a little over $680,000 in funding. And we know next year, because of what's happening with SCOTUS, that we're needing to increase that budget line item because people are going to be coming here, and we already were not meeting the need. We have an estimated need of about 6,600 people who actually need our funding. So that 3,200 people that we're helping isn't cutting it, right? So we are nervous because the people, again, who are going to be the hardest hit are people, again, who are experiencing poverty, are Black and brown folks. Of the vast majority of people who call our helpline, 72% are already parenting at least one child at home. So you spoke on this, Farah, earlier, but that these are implications that aren't just for a person, the person who's pregnant, but entire families, you know, entire ecosystems of communities, generationally so, that are impacted by these racially unjust laws.
Right.
And you know, we're scrambling to figure out how to, first and foremost, let people know in all of the ways, like billboard ads, bus ads, newspaper, radio, all of the ways that we can, letting people know that abortion is still legal and we are still funding them in Pennsylvania, because you're right that they are instilling this chaotic circus by design to hem people up and have people unclear about what they're able to do legally or not, right? And so we just need to let abortion seekers know you can still get an abortion in Pennsylvania. This is how, this is what your rights are, you know. And also for
Elise-
traveling from out of state, we also need to let them know how to get access to our care.
Yeah. Alicia, I'm just going to ask you to circle back to something, because I feel in my conversations with folks, I feel like this is something that's not widely known. You mentioned before how much funding you give the average person, and like how much do abortions, can you just share with folks how much abortions cost?
Yeah,
Because it's actually a very, very cheap medical procedure, you know, by objective standards.
we love this question because it's not an easy question to answer, and it actually highlights the barriers, right? So if you're talking about just the actual cost of the procedure itself, we're talking about $450 to $500, right? So relatively inexpensive. Also, most of us living paycheck to paycheck can't swing that kind of cash for an unexpected expense, you know? So we know people are compromising other payments like rent, food, you know, phone bills, things like that, in order to pay for this abortion. So the procedure itself, again, for $400 to $500, but you have to take into account lost wages. A lot of the folks that we talk with are working jobs that don't have paid sick leave. So when they're out of work for 2 days, because again, Pennsylvania requires that 24-hour wait, then they're not getting their wages. So missing out on that. Childcare, I just said that most of our folks are parents, so you have to consider how you would pay for somebody to get childcare. Transportation, people are usually driving someplace or figuring out trains or buses and things to get to care, because so many of our counties don't have an abortion provider. And so, and those are just some of the other expenses that one would have to take into consideration, sometimes lodging. There are practical support networks in our city, but maybe folks don't know about that, aren't tapped into that, and so don't know how to take advantage of those free services, you know. And they shouldn't have, it should just be free, you know, like that's the other thing that I want to let people know, is that abortion and the medicalization and politicization of abortion is a US born like designed to perpetuate white supremacy. You know, our neighbors to the south in Cuba, they don't even consider it an abortion up until 8 weeks. They call it menstruation extraction. So, you know, like your period's a little bit late. Oh no, let me go to the clinic for free and get, you know, bring my period back on. And so it's only not only, but in the US, it's just so much more prominent than other places, by design, intended to perpetuate white supremacy through reproductive coercion. That's been going on since the Native genocide.
Yeah, thanks for providing that context, because I know that the cost, I wanted to give people a sense of like how significant $130 was. So you had started talking a little bit about your public education campaign. Can you talk more about what that means in terms of like empowering communities?
Yeah, so we feel very held and comforted by our partners at Women's Law Project, at Planned Parenthood, PA advocates, who are taking on the legal and legislative. And we really have our lane identified as community. And so we really want to lean into building community power and fostering community support. And so what that means for us is that we want to make sure that abortion seekers, families, people who are parenting, and especially folks who are experiencing poverty are taken care of, that they're not missing from the equation when we're thinking about these harmful abortion restrictions. And so we want to do a few things. One is we do want to put a campaign out there, and we'll be looking to our partners to boost those messages in social service agencies and other places where folks are congregating, to let folks know what their rights are, how to access an abortion, what it costs, and how to get abortion funding support. We also are Signe hinted at this a little bit, but these awful, violent anti-abortion centers use tactics such as free pregnancy tests, free diapers, free formula to lure people into their clinic, right? Just so that they can feed them this like awful, violent propaganda. So we want folks to come through us instead. So we are creating an effort to distribute that stuff. So emergency contraception, condoms, lube. And I say lube because people are having sex. That's how people are getting pregnant. Most people are having sex because they want to. Every once in a while, like about 5% of people who call us have gotten pregnant because of non-consensual sex, but most people are having sex. So we want to give them the lube, then the condoms. So we want to give these community resources to make sure folks are taken care of, and then ultimately build skills and knowledge and resources that are already existing in communities to make sure that folks can fight together with us, alongside us, for abortion liberation in our state. So that's what we see as our lane, and are excited to continue doing this work in partnership with the folks who are on this call.
Thanks, Alicia. And turning back to the influx of folks from other states, and this is for any of you, do you want to talk a little bit about the scope of that? I know Guttmacher did some research on that. And, Signe, you mentioned that folks might be coming as far away as from Kentucky.
Yeah, we actually had we coordinate lots with our C3 health centers, and try to get together with folks biweekly or monthly, and have been asking, we know y'all already have waiting times and waiting periods already. I think a lot of our clinics already have a 1 to 2 week delay. And we actually just heard recently that one of our health centers did see somebody from Kentucky already. Yeah. So someone from Kentucky came to access abortion care in Western Pennsylvania.
Yeah, I don't think there's any doubt. We've certainly seen one number at least an influx of 8,000 people, and everyone thinks that's a very modest number. I also just want to mention something about judicial bypass, if I can, and teenagers, because teenagers are more likely than anyone to wait. And because people will be lining up for appointments, we can get them. We have to be able to make sure systems are in place. It may be more complicated. It is more complicated in some cases for them to be crossing state lines if adults are helping them. There are a number of issues, but our biggest concern is that we know teenagers wait. And it may be that it becomes too late for them. So paying attention, and I so appreciate Alicia's work in the community. And if I will say, I think one of the reasons we've gotten where we've gotten in this country is too much reliance was placed on the lawyers, and there wasn't this kind of community outreach and activism while the other side has been building their movement and their momentum. So I think that's important. And Alicia, we'll talk more about maybe some other strategies to get to the young people, given the experience, because we represent young people in judicial proceedings in Western Pennsylvania. So we're gathering more information about it, but and because of that, we're really worried.
Thanks for that context, Carol. And I don't know, Alicia, we didn't discuss this before, so apologies if you don't have this data handy, but what percentage of the folks that you all support are teenagers or young adults?
I actually don't have that data at the front of my brain, but it's a pretty substantial chunk of folks who call and need that support, and it's not an easy thing to have to handle when you know that somebody is needing to seek a judicial bypass. But just as a reminder, like the people who can tell their parents, and the people who don't tell their parents for a very specific reason. And so, you know, we want to just to Carol's point, just really wrap our arms around figuring out how to get the word out to folks around the judicial bypass process. And I also just want to point out that there's layers upon layers of oppression that we have to fight against, right? So yes, there are folks externally trying to outlaw abortion, but also even within the court system, folks are facing not the best support and care. I don't know if this is still the case now. It might have changed. This was some years ago in the before time, but one of the persons who was talking about the judicial bypass process, who was one of the folks internally working on it, was using phrases like, you know, young ladies, and we just want to make sure that they aren't, you know, making the same mistake again, and just very condescending and patronizing and sex negative and just awful. And so we have to transform systems from within too. I mean, ultimately abolish them, but in the meantime, you know, reforming some of these systems is also something that we have to do. And we joke all the time at ALF that sometimes like the calls coming from within the house, you know, like it's not even people who we have to fight against who are just the blatant antis. It's folks who are on our team who are enacting harm and enacting violence. And so we have to do our due diligence also internally to interrogate, you know, how are our organizations, our coalitions, our medical environments, you know, perpetuating transphobia? Are you only talking about this as a woman's issue? Are you only talking about this using Handmaid's Tale references? Like that's violent and it's racist. Are you only saying that a person should only get one abortion in their life, that they should only get it if they're only certain weeks along? Like all of these things are coming from within the house and also need to be handled, because part of the thing that the Turnaway study, or that your points didn't mention per se, is just this is emotional violence. Like this is toxic on bodies, right? Like, yes, the financial implications, you know, yes, child adverse effects and things, but also it's just violent for a person's body to have to be forced to carry to term when they can't or don't want to be pregnant. And I think that sometimes we sidestep that just because it's just assumed, you know, that the state should control our bodies. I think people just forget, like, we do not belong to the state. We are not properties of the state. And so, yeah, I hope that people stay as fired up, because this is a long haul. Like, this is not a sprint, this is a marathon.
Yeah. Can I just ask you or Sydney or anybody else to just jump on to talk about, you mentioned, Alicia, language and how we, even folks who are supportive, can use language in ways that are harmful. Can you talk about why the coat hangers are bad?
Sydney, you want to start?
I think you always tackle this a little more eloquently than I do.
I have zero eloquence today. I have zero filters.
I like the no filter.
The coat hanger reference is bad because it implies that anything outside of a clinic is automatically deemed unsafe, or that anything that is not legal is automatically unsafe. And it really harkens back to a very white feminist ideology that completely negates the Black and Brown experience of abortions that happened in community by birth workers and doulas, oftentimes using traditional medicines. And it wasn't until our not too distant past that it was literally torn out of communities' hands because of white supremacy and capitalism and the patriarchy, all of the things. things, the trifecta, who said, you know, we need to medicalize this procedure, and also not only medicalize it, but we're going to stigmatize the way that the community was doing it before. And that then opened the door for regulations to happen and people to profit off of this procedure, when before it was happening in community, it was happening safely, using traditional medicines that are now deemed less sophisticated and as seen as harmful. And so that coat hanger imagery just dismisses that, right? As does The Handmaid's Tale, as does all of that. And I think the part of it that's also scary, and Carol, I would love for you to speak on this part of it, is that we are really grappling with language at ALF, because we want to reject the notion that abortion should be safe, legal, and rare. Like, we've stricken that from everything, from our lexicon.
Right.
Encourage others to do so as well, because abortions are going to happen no matter what, and they're going to happen safely. People are going to manage their own self. They're going to be able to self-manage their abortions like they always have. And the criminalization specifically of Black and brown bodies in a post-Roe world is going to just be so scary, because people are going to be put in jail for managing their own abortions. And because of the connection between reproductive coercion and the criminalization of and the prison industrial complex in our country, we know that the targeted folks are going to be Black and brown folks. So I don't know, Carol, if you want to speak on that. But.
Well, you know, I think one of the things that we've seen, and one of the things that in the past we've done considerable work on, is the treatment of pregnant and parenting people with substance use disorders. And I think that we have managed, before the Pennsylvania Supreme Court and before the Third Circuit in Pennsylvania, to eliminate those prosecutions here, but they happened. And to think that, for anyone to think that a miscarriage is not going to be criminalized, since we have volumes of cases of that throughout the United States, it's going to happen. And I think that the system of blaming, of categorizing people according to what that looks like their status is. And certainly a person with substance use disorders has been mistreated in so many ways, in so many systems. And to criminalize just the use of drugs during pregnancy, much less anything connected to ending pregnancies, that whole continuum, and the lack, what we see time and time again is the lack of interest in helping people have healthy pregnancies. That's the most astonishing part about all of this. It's the most astonishing part even about the language of the proposed constitutional amendment. It's really no concern with life after birth. Anyway, I think that that's a really important part. The ramifications of this and the control over the reproductive capacity of the population who can reproduce is intense. And there is no question that historically the law has and the efforts have gone after the most vulnerable. But I think one of the things we've also learned is there is this huge fear that by the year, 2050, white people are going to be in the minority population. So there is the white supremacy issue is, of course, connected to keeping a servile population in that position, but also maintaining the white race. And that's an uncomfortable place to be. People don't talk about it enough, but that's the continuum of where we are, and the punishment of having the ability to reproduce is, what's at odds right now, and what's at stake right now.
Right. And just to add to something you said, Carol, about there just being no concern about life after birth, it's one of the weird contradictions in Pennsylvania too, that, you know, it's one of the states where there's no mandated sex ed. Where it exists, it's pretty sad. And, you know, they only recently, I believe in April, extended Medicaid coverage for postpartum women to a full year. Before it had just been 3 months, and that wasn't even initiated by the state. You know, it was a response to proposals from the Biden administration. So there's on the one hand, there's this concerted effort to force people to procreate, and then on the other, not the attendant supports for that.
And we have at least 5 counties in Pennsylvania that are considered maternity care deserts. That access to maternity care, and in some cases in Pennsylvania, people particularly with high-risk pregnancies who are outside the major metropolitan areas where there is sophisticated healthcare are at great risk. And, you know, what effort?
Yeah.
I also want to add that just from personal experience, currently 31 weeks pregnant. Ooh, here's my pregnancy.
You're getting close.
I'm getting close. And I think there's also this assumption in Pennsylvania, right? Like, especially if you're from Philly or Pittsburgh, right? That we're really spoiled here, right? We have this awesome medical infrastructure, right? Big hospital, big research, you know, and when I was trying to access prenatal care, was on a wait list at Penn, or, you know, trying to get care. You know, you can't even get scheduled to even meet a pediatrician until after the baby is born. And even then, you know, they have limited slots for newborn care. And, you know, I'm getting really comfortable with my OB, and, you know, he's like, there's only 6 of us that will deliver for all of Drexel. There's 6. So, you know, there's also a provider shortage. And something that we also aren't really layering into this conversation is that there's a lot of assumptions made about what the landscape looks like in Pennsylvania. And I think all the reasons so important to, you know, really talk about that. At least on our end, we've been working with the legislature. The postpartum piece really came born out of the Women's Health Caucus and a few of the Women's Health Caucus chairs in the legislature who got together and said, why hasn't this happened in Pennsylvania, right? Like, why aren't we getting this done? And worked with the administration to really push that forward. So we've been also doing a lot of education, you know, going back to the language piece too, is that, you know, we always talk about choice. And I think Alicia, you know, with the coat hanger piece and the Handmaid's Tale references, it's like, we blatantly want to call the opposition, like, they are anti-abortion. They are not pro-life, you know, and when we're talking about those labels of choice and not choice, right? I think important to lift up that for a lot of communities, particularly communities of color, we've never really had the choice, right? So I think our language is really important, and just lifting up not just that piece as an educational tool, but also understanding the full scope of what the landscape is in PA, because there's only, you know, at Drexel, 6 providers, you know, and I think that is crazy. I mean, I was on a wait list for Penn for months, still haven't gotten a phone call. So I think really important to lift that up as well.
Yeah.
Oh, thank you all for that. I feel like every time I get together with reproductive justice folks, I learn so many things. So I'm gonna sort of flip us back to talking about what funders can do. So I'm going to share my screen again, and then we're going to move into Q&A. And I think there are a couple of questions, and then folks can have a broader discussion. So let me just do that. So obviously, you know, as funders, what we do is fund things. And so the most important thing is funding. And Eddie sort of alluded to in the chat, what are other things. But I think even within funding, you want to be strategic about that, right? There is going to be a short-term issue. There's going to be a lot of people coming in, and so funding abortion providers, funding abortion funds, helping people get the services they need today, here and now, is going to be important. But also longer term, you know, funding advocacy, funding work to, overturn a constitutional amendment or get Medicaid coverage or stop funding crisis pregnancy centers and maybe instead fund, daycare, things like that. And then there is also, and we talked about this a little bit, a stigma, destigmatization, and sort of the associated emotional violence of the way abortion is discussed and the way that folks are made to feel for wanting or seeking an abortion, and sort of just doing a shifting culture, doing culture change, I think is also really important. And there's some folks that are working on storytelling as part of this. And so those are more long-term, interventions to try to sort of shift the conversation. One of the things that I really want to highlight is that it's very important to follow the lead of organizations that have been doing this. As Alicia mentioned, that there have been people who have been doing this work for a long time. I just want to shout out Carol Tracy, who's retiring soon, who has given 32 years of her life and energy to this work, and the abortion fund, Abortion Liberation Fund was one of the first in the country. One of the people, they were one of the funds who helped start the National Fund. Planned Parenthood has obviously been around a long time. So there are a lot of people who have been in the trenches, and what they need from funders is for funders to say, what do you need? How can we help? As opposed to swooping in and trying to save the day without necessarily understanding the context and the needs. That is certainly very much the tactic we try to take at Gender Justice Fund, and we think it works out for us. The other thing, and this might be getting into the question that Eddie asked, I'm really hoping that folks can sort of start thinking about how this intersects with your work, and talking to grantees about how this might impact them. Are you working with folks who fund homelessness, homeless shelters, or domestic violence, or youth? We talked a lot about how young people have various restrictions, either because they're young and they need judicial bypass, or because they are more likely to wait or less likely to understand exactly the implications of what is happening. And so, are there opportunities, if you were a youth funder, to sort of engage in somehow supporting your grantees as they support young people in the community? And also, providing resources, information, education. I think, as I mentioned before, it feels like there is a deliberate concerted effort to keep us confused. And so the more information that is out there, sharing with grantees, with your boards. I know Gender Justice Fund, we had a board meeting maybe 3 weeks after the draft memo leaked. It's not a memo, but after the leak, and we just sort of canceled half the agenda and spent time just talking about it and thinking about how we might, respond and what opportunities there might be. And we have certainly not cracked that nut. But I think you won't get anywhere without starting to talk about it. Carol was mentioning before we got on the call that she was around for Planned Parenthood v. Casey, which was in 1992, Carol, which was a big Supreme Court case that Kitty Colbert argued that people thought would cause us to lose Roe, and we didn't. It just got a little more right shaved off. But Carol, actually, why don't you came off mute? Why don't you tell us what it was like at the time trying to talk to funders?
Yeah, well, what we were talking about at the time is funders had like zero interest in supporting this, but even conversations in places, quite frankly, like the Bar Association, we were when the opinion was leaked several weeks ago. I was at one of our Bar Association meetings. That's how it began. And I thought, boy, you know, having been there and having been here, there's far more public discourse around it. We were members of Women's Way. There were funders who wanted to divert money away from organizations that provided abortion, us, Elizabeth Blackwell, Choice organizations in those days. So I think that there's been a cultural sea change, which is amazing. And I think it'll take us a while to unsort. Everyone expected this opinion, I think. Those who were paying attention, the fact that it was leaked has given it more legs, I think, in ways that I think are exhilarating. I really do. And I think, as Alicia said, there's a long haul here. You know, there's a short haul about what's going to happen in June. And we fully expect them to issue the opinion, although there are many pundits who are saying they could sit on this. They could sit on this for a while. They are not required to issue the opinion at the end of this term. They may want to wait till after November, after the election. There are all kinds of possibilities around it. But I do think that these 50 years of having these rights and weathering a lot of the challenges, but you know, not fully coming to terms with the incremental loss. So it gives me some enthusiasm. And though I have been at the Law Project for 32 years, I've been doing the work for 50 years. So I do have a long haul view of all of this. And I think that what I particularly think is important is getting to the place where we frame abortion along a reproductive health medium, you know, that access. And that's why the reproductive justice movement, why we've learned so much from it, because as I've said before in a different way, sometimes access to prenatal care is as difficult. And Signy's recounting right now of it is really exceptional. And anyway, I have enthusiasm and optimism, but we are faced with a huge amount right now, all of us, of additional work, and resources are needed. There is no question about that. I think the issue of destigmatizing for donors who are working in all kinds of ways, talking about abortion and pregnancy and good health care, making that part of whatever they're doing is important to do. And that the destigmatizing of abortion is really important. And I don't know that we all know how to do it, but we all know that we have to do something about it. And you know, the resource strain, on existing services are something that are kind of terrifying. All of the new legal issues that we're trying to figure out require additional resources. So there's a lot of need out there, but I also think we're in a forward motion. I think that we are pushing that pendulum back. I think we have the capacity to do it now, and the rage to do it now.
Thanks, Carol. And I think those are really great words to end on. And we just want to say thanks again to the panelists. And we are going to switch to talking about some questions that were in the chat. So first up, Eddie Irizarry asks, besides direct funding, which is clearly needed, can we talk about a little bit about ways foundations or individual donors can be more strategic/intentional about this work? And I think, you know, we heard some of those things talking about it, thinking about intersections. I'm going to ask Alicia maybe to talk about sort of your community organizing approach and how folks might be able to think about the work in that way.
Yeah, sure. So I want to talk about two separate things that do go hand in hand. I'll get to the community organizing in a bit, but I also just want to remind us that as entities, whether you're in philanthropy or nonprofit, that we also have work to do internally. Again, in the calls coming from in the House, to interrogate and atone for our anti-Blackness that seeps through our organizations. We exist because of labor that was put forward by Black folks and Indigenous folks and Brown folks in this country. And so to just do some digging internally, you know, are you paying folks a thriving wage? Like rent, we're going through all of this at LFPA, so this is why it's like top of mind, but I didn't realize that rent is $1,700 a month on average in Philadelphia, which if you're a person living alone, then that's even more insurmountable of an expense to take on. If you're a person living with a disability, that's harder. If you're a person who has a child, it's harder, right? So are you paying your folks a thriving wage? Does your health insurance cover abortion care? Look into that. If it doesn't, can you find one that does? Are you thinking about folks' housing? Are you providing, subsidies for folks to be able to live and afford to work, honestly, work to live, live to work? Are you doing the work internally to see who is your board made up of? How are decisions made? Are people in positions of leadership and authority only white folks? Are there young folks? Are there people with different abilities and things like that that are making up your staff and your board? So that's part of the work that we have to do too collectively, whether you're a funder, whether you're a nonprofit, what have you, medical institution. So that's one thing. And also too, like on a personal level, like I need to remind myself to say that too, because it's not just enough to look at the organizations and what we're going to do, but like how we are actually showing up to this work as people who are swimming in the sea that is white supremacy, right? So one of the resources that I always talk about for non-Black people of color and white people is Me and White Supremacy, which is not easy. This is not a book you read. This is a workbook. This is something you work on. If you're not doing that, you do not have the right to say that you're supporting abortion access, in my opinion. So that's one thing the camp can do internally. Do your work. And then organizationally, what I had said earlier about us really leaning into communities is that we are fostering community support, which means we are building out our community care hub, like I mentioned. We're going to be handing out emergency contraception, condoms, diapers, lube, etc. And so folks can support us in getting that out and figuring out how to scale it up. We're starting incredibly small in Philadelphia because we're a small but mighty crew. But we would love to figure out how to partner and make this more far reaching. We also are in the very, very, very infancy stage of we might not even be at the infancy stage. We might still be dating. Like we might not have even gotten pregnant yet. But we are creating an abortion doula care collective to support people before, during, and after their abortion care so that they can get some of the support that they need. Specifically, it's going to be Black-led and Black-centered so that folks can get support from folks who they can relate with and can navigate some of the harms that come that we already talked about, right? Whether it's an access issue, the emotional stigma, having to do it in secrecy and isolation because you can't tell your family that you're having this abortion. And then during the procedure itself to put some bubble wrap around any sort of mistreatment that they might get in a facility. We love our providers, and also providers are part of the medical industrial complex, to be real. And then after, right, to support a person after their procedure. So that could be with getting supplies for their family, like literal heating pads to take care of their physical body afterward, food, things like that, as well as any emotional issues that might emerge from the procedure. And I saw somebody in the chat had asked about that specifically, and no abortion is like any other. Every individual abortion is different, and so some people have an abortion, feel amazing, and are able to carry on with their life with a sense of relief. Other folks, it's harder. It's a more difficult decision that folks have to grapple with, and so we just want to be able to provide that emotional bubble wrap, if you will, to handle whatever comes up, right? And some of that emotional toll might not even be from the procedure, but the way that you're being treated for having made that decision. So we're hoping to embark on some of that support for folks, and funders can support that work. Funders can show up to see how to help build this. We don't yet have it built out, so being able to get support for entities and organizations that are building would be also helpful. And then to your grantees is also just thinking through helping people connect dots between like defunding the police, for example, or improving education, for anybody, like K all the way up for folks, or like assessing the prison industrial complex. Like all of these are intersecting issues that can and should be addressed and discussed in relationship to abortion. And then this is the last thing I'll say, and then I'm going to be quiet, is I think Carol alluded to this earlier, but like talk about abortion, like say it, let it come out. Somebody that you know has had an abortion. If they haven't told you, think about what it would mean to become a person that people can confide in about their abortion story. There's a great resource that I'll drop in the chat from the National Network of Abortion Funds called Abortion Heart to Heart conversation. So it's just little cards that would help you get the conversation going so that you don't have to reinvent the wheel. So there's ample resources out there for folks to talk about abortion, support abortion access, and support your crew of people.
Thanks, Alicia. I don't know if Carol or Sydney, you want to weigh in, or should I move to another question?
I'll just add that we've been, to Alicia's point about lifting up folks' lived experiences and also just thinking about folks on the ground, right? We've been really ramping up our storytelling efforts at Planned Parenthood. I think oftentimes, as leaders in this work, like we are called on to talk about these issues. And I think it's really important to give space to folks who are fired up and ready to share their experience. So after the SCOTUS leak, we actually saw thousands of people who are interested in volunteering and hundreds of people who are ready to share their story with the world. And I think that like the impact of storytelling is so important, and we're really excited to layer it into whether it's mail pieces, right, for electoral efforts or accountability efforts and digital ads, if this constitutional amendment moves, right? I think just the piece around storytelling and actually having folks who have had abortions, who have gone through the doors, right, actually be at the forefront is just so important to us. So I just want to lift up that we are really trying to ramp up those efforts, and our team's working on just basically a backlog of folks who are ready to go. And, I think thinking through some of those special projects is going to be really important, especially when for the leak, we had folks like reaching out, like, can we talk to someone who's had an abortion, right? And also the community care piece is really important. This is also a difficult time for people who've had abortions, right?
Yeah.
Like, I think the world can make us feel really ugly. And, I've, as someone who's had an abortion, right? Like, this is heavy. This is really heavy. Despite that we know that there's support out there. It's really difficult to grapple with and wrap your mind around the fact that something you've accessed or something that you did is so incredibly politicized, and it shouldn't be. So I think all the reason to support some of the storytelling efforts for some of our folks who are just ready to share their lived experience too.
Thanks, Signy. I realize I jumped to the second question in this chat instead of the first, which I will address only briefly because I'm definitely not an expert, but Sadia asked how effective / useful political education has been to disrupt the myths / miseducation about abortion access, because there are spaces where abortion access is viewed as a tool of legalized genocide allowed by the US. And I assume, Sadia, you're talking about particularly Black spaces, but this is where I've seen that. And it's really hard to sort of argue with folks who are very committed to that idea. But, I think you want to think about who you look to as sort of like Black leaders in these times. You know, Bell Hooks obviously was about Black liberation, but also very much about bodily autonomy. And I think connecting bodily autonomy to, you know, liberation, to the idea that control of reproduction has roots in slavery, and that, you know, the solution isn't for everybody to have kids or to not, or whatever. Like the liberation is everybody being able to make the best decisions for themselves, and to have the resources to do that, and sort of looking also to reproductive justice. You know, Laura Ross and those folks that started that movement as part of that. And Alicia just put in the chat a link to trustblackwomen.org, which is a project of Sister Song, which also I'm guessing has resources that might be helpful. Thank you, Alicia. Jennifer Leith asks, what funders can do to support immediate actions when SCOTUS issues its decision on Roe? How can we best amplify those efforts and share with grantees? And yeah, I mean, yeah, like immediately, like say Dobbs gets decided tomorrow, what do people do? I know when the leak happened, I sent cookies to the folks at the Women's Center because it was all I could think of to do. And I made donations. But yeah, you know, being an abortion provider in times like these has got to be, you know, there are also no providers on this call because I did not want to ask anybody for anything. So, you know, folks who are in the trenches daily, holding people's hands, tears, and all of that. So
what's absolutely important right now, I think, is making sure that accurate information is disseminated, because we know how damaging social media can be. So, you know, I will say you can look to us and other legal providers to do the legal interpretation of what this decision means. And it's really important to be able to provide the resources to communicate that actively. I mean, part of what we hope that we will, that our legal lane in all of this, particularly in Pennsylvania, is making sure that we provide as much accurate legal information as we can to the community at large, because misinformation, I mean, we know how damaging that is. So amplifying the messages, providing resources for that is, you know, that can be, depending on how one does it, that can be expensive. Planned Parenthood, you know, the advocates are going to be, already are amazing in some of the comms that they're doing, that we're seeing on television right now, that I can't go into because it's electoral, but just some amazing communications are out there now. Amplifying them is really important, and in whatever way you can, supporting them.
Yeah, 100%. And just to piggyback off of what Carol said, it would be nice for folks to follow the lead of folks who are doing this work in terms of how to message this, and then actually put out a statement. You know, I don't know if that would be something that, you know, funders could or would want to do, but just remembering that this isn't a siloed issue, and that if you're an organization that, let's say, supports environmental justice or, you know, youth education or something like that, you can still issue a statement in support of abortion access in this country, right, in Pennsylvania. So issuing a public statement with language guidance from folks who are on this call would be great, so that you're not replicating harm. Don't say Handmaid's Tale. I'm going to keep saying that so I don't have to say it anymore. And so that's one thing that folks can do for sure. And then, of course, just, you know, thinking through who has boots on the ground. So that is abortion providers, that is funds, and other mutual aid efforts in your community. You know, it doesn't have to be, it shouldn't be a large nonprofit or even a smaller nonprofit, but where are the healers in your community that are providing, you know, food? We saw a huge uptick in this, obviously, through COVID, that are still happening now. You know, there's refrigerators around the, you know, the city, and how do you resource that? How do you resource, you know, mutual aid efforts that are literally boots on the ground helping people today? We always like to lift up bail funds, you know, like our folks we know are differently targeted by police. And so can you support the work of like bail fund communities, you know, things like that. If you are in a position to give out grants, I wrote it in the chat, but I'll say it again, that we always love multi-year general operating grants. I love the move that some folks are making, where rather than doing a report and then an application, it's just one, which is beautiful, or you can use a application for another grant maker for your application, like anything to make it easier to get this money and work in partnership would be ideal. Most of us are really scrappy organizations. I'm the grant writer. So yeah,
Right.
anything to lighten our,
Right.
anything to lighten our load is much appreciated. And cookies are great.
Singni, did you want to weigh in?
No, I just adding what Alicia said. She said, I'm the grant writer, and I'm like, same.
Same.
The comms director right now. So
All the
if you're interested in
hats.
comms and
Yeah.
storytelling, we'd love to fund our comms efforts.
Yeah, and I do want to add that, you know, our reproductive rights team is led by Sue Fritchie. And if people, and Sue and Christine Castro and Amal Bass are really, the three of them are the leaders in the organization now. And if you have questions around this, and particularly the issues that where we have the most expertise, the legal issues, feel free to be in touch with us. But we do have a really strong and frankly, very experienced, sadly enough, but very experienced legal team here in Pennsylvania. So in any ways that you need information or guidance, and obviously we can always use the support. We actually need more lawyers. There's no question. That's what we are sitting down as Alicia's. We're all sitting down working on how are we going to fill the gaps? How are we going to provide the direct services right now that are needed, you know, post odds and in the future.
Yeah.
These are clearly unanticipated issues for us, and they have to respond to them quickly.
Yeah. Annie asked if folks can talk a little bit about challenges you've run into when speaking with individual donors or funders about these issues.
So people don't want to hear that abortion is white supremacy. And so this is why I implore specifically white and non-Black people of color to gather your people and to let them know, and to, if you have the capacity and the bandwidth, to educate one another about how it absolutely is white supremacy in action, how it's not, it's toxic to say that this is a women's issue. It's not healthy. It's not okay to dismiss the leadership that's gone on since the early 90s of Black folks doing reproductive justice work. Like, follow the leaders, right? Like, these conversations are not new. They're just differently coming into focus now and being shared in ways that have literally gone on for generations by Black folks. But yeah, it hasn't been easy as we've continued to go through our transitions at Abortion Liberation Fund. Our name change and even talking about abortion as an act of love has certainly ruffled some feathers. But I also think it's garnered in a lot more appreciation and support, and people are seeing themselves reflected in our work in ways that they hadn't before. So we're actually seeing an uptick in people who support this work, which I think is a testament to the fact that we're on the right path, and folks are going to fall away if they need to fall away. Maybe it's just not the right time for them to think about these things. I was going to say something else, but like we're confident that folks will come along with us for the ride, and so far that's been the truth. Yeah.
I'll echo the language piece. I got angry emails because I said Josh Shapiro was pro-abortion, you know. People get really upset about the work we're doing internally and with supporters and with legislators, right? So I echo that piece. And I also just say that for our work over the years, we've seen it become more and more difficult and challenging to identify C4 lobbying dollars, right? So I think for a lot of the work that we want to do with the constitutional amendment and accountability work, that is really important for us so that we can get to a sexual and reproductive health care trifecta, right? It would be nice to have the House, the Senate, and the governor to reach that, right? We're going to need a lot of C4 support. And over the years, it's just been really difficult to identify those dollars and get those investments.
Yeah, and I'd like to amplify how important that is, because people like us are the Law Project and Alicia are limited in that, and we rely so heavily on Signe and Planned Parenthood advocates and others that are out there doing the work, because that's ultimately where it has to happen. And to the extent that anyone who's listening to this can distribute C4 money, it is really needed. And I think we'll all speak against our organizational interests in support of that.
Right. All right. Thank you all. Just realized it is 1 minute before closing time. I'm going to turn, I want to just say again, thank you so much to all the panelists for being here, but also just for your work and for your dedication. And I am going to turn things back over to Mariah.
Yeah, thank you everyone so much for being here. I think, it was a great discussion when pretty much no one dropped from an hour and a half discussion. So that's how important this is. So I just put in the chat just a prompt. What will you do? I think that's what this really comes down to. So please share publicly or DM me if you want to make it private. What is it you're thinking about next for you? We will also follow up with the recording, resources, mentioned, shared in the chat with everyone in the coming days when those are all ready, so that you have all of those, the information to consider and use going forward. So thank you again. Before you leave, please share what you're going to do in the chat, and hopefully see you next time.
And thanks again, Philanthropy Network, for not saying no when I suggested this.